In 1997, a young girl in Cambodia fell ill with fever. Doctors confirmed that Mum Chanti had polio. She had missed a vaccination and would be paralyzed for life. Mum would become the last known indigenous polio case in the Western Pacific region. 3 years later, in 2000, the Western Pacific region, home to 1.8 billion people, was certified polio-free. For the next 10 years, the region has remained polio-free. Polio is an ancient disease that disables for life and even kills. There is no cure, but prevention is easy thanks to a safe and reliable vaccine. The virus is powerless against an immunized person. If the virus cannot transmit from one person to another, it reaches a dead end and can travel no further.
Children everywhere, and indeed adults too, will remain at risk until we have completed the job of global polio eradication.
In 1988, when the WHO World Health Assembly launched the Global Polio Eradication Initiative, polio is endemic in over 125 countries. At least 350,000 children were paralyzed each year. In the years that followed, the initiative, spearheaded by WHO, UNICEF, Rotary International, and the U.S. Centers for Disease Control and Prevention, mobilized 200 countries, 20 million volunteers, and $8 billion US. More than 2.5 billion children were immunized. As a result of these unprecedented efforts, in 2006, only 4 countries had not yet stopped the transmission of polio: Afghanistan, India, Nigeria, and Pakistan. By 2010, the infection rate was dramatically reduced, from an estimated 1,000 children a day in 1988 to less than 1,500 children infected in an entire year. The annual case numbers globally had decreased by 99%, but the remaining 1% still threaten the rest of the world. As long as the polio virus exists anywhere, it can affect anyone who is not fully immunized. It does not matter how long a country has stayed polio-free. All that can change in a moment. And in 2010, in Tajikistan, it did just that. On 23 April 2010, the Russian Reference Laboratory confirmed an outbreak of polio in Tajikistan, a landlocked, mountainous country in Central Asia with a population of 7.3 million people. From there, polio spread further into the Russian Federation, Kazakhstan, and Turkmenistan. Tajikistan, together with all other countries in Europe, had been certified polio-free in 2002. The last polio case in the region had been a young boy in Turkey in 1998. Just like little Mum in Cambodia, Melik Minas got polio because he had not been vaccinated against the disease. China and Mongolia, as polio-free neighbors of Tajikistan, felt an immediate threat from the virus traveling across borders. Both responded swiftly. Guidelines for preparedness and response were issued to healthcare providers. Extra vaccination campaigns were organized, particularly in border areas. Disease reporting systems were enhanced, and close watch was kept on polio events in Europe. The outbreak in Tajikistan was eventually controlled and no further cases occurred after July 2010. Yet it left 457 polio victims, 29 of whom died.
支持上，由政府主导，专业体系、专业队伍来积极的来工作，使得广大的群众呢、公众对于季款免疫接种要有一个非常好的一个。
In July 2011, public health experts from the Chinese government, the World Health Organization, development agencies, and neighboring countries from across Asia and Europe gathered in Urumqi, Xinjiang, China. The challenge they faced was simple. How do we work together to stay polio-free and ultimately eradicate polio from the world? The experts identified 5 main lessons and action items for fighting polio.
We have a double challenge that the re-importation of virus from border area and emergence of Western-derived poliovirus from pocket area of routine immunization.
И совместными усилиями, естественно, мы должны бороться с полиомиелитом. И заранее информировать друг друга, вернее стран, о сложившейся ситуации по этой болезни в каждой стране.
It's very critical to join hands, join heads, and to join the thoughts, and then make a joint sort of work plan, so that we should not leave any child in the bordering areas, particularly where the people are crossing to each other's country, and we should reach those children and vaccinate.
The risk assessments of potential importation and spread could be shared, as well then looking at how mobile populations move across countries.
This can lead to something much bigger than just polio, and we have an opportunity and a responsibility to seize the moment and build on something for our children.
Countries, WHO, and partner agencies attending the Urumqi polio meeting pledged to work together more closely than ever before to meet the goal of eradication. They know what is at stake. We are almost there, but almost there is not good enough. We will not settle for containment. We must eradicate polio. The last mile is always the hardest, and we are taking our fight to the furthest village, the fringes, the borders, to populations on the move, in conflict, unaware, to every last child.